My name is Sadie Brown, and welcome to the VUCA show. So we will be having a conversation on HIV prevention methods, options, and choices. My name is Sadie Brown. I am based in South Africa. I'm an HIV victor. I'm an HIV activist, and I'm a young person living with HIV. I work with the AfNHI youth cohort. I'm a part of that cohort, and we are pretty much just advocating for the ability for people to have access to prevention methods, access to prevention options, and for them to be able to have their own choices, for them to be able to say, this is what I want to do and this is how I want it to be done. So I am going to be having a dialogue with an amazing person called Shakira, and she is an advocacy officer. She's based in Uganda. Hi, Shakira.
Hi, thanks for
How are
having me.
you?
Sir. I'm
Thank you so
okay.
much. I'm good, thank you. So we have been having this conversation about the ring, and I would like to hear from you, why you think that the Pivorin ring is a game changer, and how you think it's going to completely change the lives of adolescent girls and young women.
Thank you so much, Sandy. Thank you for having me on this call. Why I think that the Pivoring ring is a game changer. It's one because it is an addition on the basket that we have of HIV prevention options, and we know that women in sub-Saharan Africa are not the same. We are very diverse. We want different things, and adding the ring into the basket of HIV prevention tools is an added advantage for us as women. Women gave their bodies in sub-Saharan Africa, gave their bodies to research, and this research gave us evidence that showed that the ring actually works and prevents women from getting HIV infection. So us not giving it to the women or not making sure that women who actually need it can access it is a very big disservice. And they gave the only money they have, and that is their bodies. And also the ring is something that women can use in confidence, and also in discreet, just for them to be in control of their own protection. We know that women in Africa or AGYWs in sub-Saharan Africa do not have the power to negotiate for safer sexual experiences, like using condoms. Condoms are mainly male dominated, and women in sub-Saharan Africa or AGYWs don't have the power to negotiate for that. And the ring comes as an option that is, first of all, female centered. So it is the woman that uses it, it is the woman that is in control, and it gives her the chance or the right to be in control of her own protection. And we are also pushing for prevention options and choices. We're not saying that the ring is going to come and magically stop new infections among all women in sub-Saharan Africa. But even if the ring saves 10 young women in Africa, it is actually saving 10 young women, and that is where we should put our emphasis and our focus, and also make sure that women who actually need the ring and want to use the ring can have access for it. Yes. So that's why I think it is a game changer.
Yeah, I've been listening to you speak, and it really is going to be a game changer. And I feel like, even like as young people, it is so important for us to have such options, because that also kind of lessens the burden of HIV in our lives. And I think it's important that we also just keep on mentioning that, so that people can just realize how important something like the ring could be for adolescent girls and young women. Thank you so much, Shakira. And I would just also like to know, what is your message if you were to speak to policymakers, change makers, the government? What would you say is your message regarding the ring and the access to it?
My message to policymakers and funders is that as much as we see them as policymakers, as funders, they are part of community, and it is
Mm,
our collective response to make sure that we end new infections among adolescent girls and young women. And we very much know that HIV in sub-Saharan Africa wears a female face. Like every single day, we have young girls, we have young women that are getting infected every other day, and it is our collective responsibility to make sure that we do everything that we can to stop these new infections or to minimize the new infections. And also, it is our collective responsibility as community to make sure that women understand and have choices. So my message to policymakers is, let them champion the ring and making sure that there is accessibility even after research. We need the policymakers to be championing the ring, to be leading in conversations, asking questions, following up on commitments that are being made, and making sure that we give women these options. As for funders, we would want to see them continue to add on to the HIV prevention basket options for women and girls. And with this, we want them to increase accessibility, increase the research around the ring. We need the research around the ring funded and implementation programs funded. We need to do everything that we can do to make sure that the woman in my community down who has no access to internet can actually get, the ring. And the ring is giving us this option of women can easily put it in there by themselves. Women can easily remove it by themselves. Over time, we have had challenges with services for AGYWs that are gotten through health facilities. There is a stigma around access to HIV prevention, mostly for adolescent girls and young women. Because if you're going to a health facility to get prevention options, you're seen as someone who, at a very young age, is being promiscuous or is doing the wrong thing, and yet girls are just seeking to protect themselves. So the ring is such a game changer in a way that it gives them the option to even do this at the comfort of their home. It is something that you can do at home. Once you know how to use it or how to insert it, it is something that you can do easily at the comfort of your home and remove at the comfort of your home. And I think it will reduce so many of those gaps that we are seeing in HIV prevention service delivery. And I call upon all policymakers, all funders, all community advocates, let us be on top of getting the ring to the communities of women that need it. Thank you.
Thank you so much, Shakira. We have been getting comments. I have this one from Dr. Lillian Benjamin. She's saying, well stated, Shakira, it's our collective responsibility to control HIV prevention. I also saw a comment from Gloria that said that not providing the ring to young women is a disservice to them. So it's important that we create platforms, a world where we don't need to be worried and don't need to be stressed about how to prevent ourselves from not getting HIV. It's important
Mhm.
that we keep on applying and implementing preventative methods that will not only be there to prevent HIV, but to also be able to give us the ability to have a choice and an option to get those things. So thank you so much, Shakira. I think that we need to just come together and also understand that there were young women who gave up their bodies for these trials, and it's quite
Mhm.
unfair, and it's a big disservice to not now want to give these young people access to this preventative option just because now the trials are over. So thank you so much, Shakira. I think that for now we just need to also like speak on like the various options that other young women and adolescent girls can use now.
Mhm.
Mm-hmm.
And you see, the thing is, most of the times when we are doing programming in our countries for HIV prevention, we often leave the adolescent girls out. And most of the guidelines start at 18 years, and we're seeing that adolescent girls are getting infected more and more compared to boys of the same age. 15
Mm-hmm.
years old are lesser than 18. Actually, girls are getting infected really, really early. And it's because they're starting sexual experiences at a really young age. So we need to make sure they have the information. We need to make sure they have the tools that are available as we work towards getting them those that have been approved that are working. We need to make sure that we are working towards getting these tools to them. And like I said, women are really, really different. What I wanted 6 months ago is not what I want right now. So in the last 6 months, prep oral prep could have worked for me, and right now, let's say it's something different. Like for someone, every time women's lives are changing, and we are having really different opinions, different preferences. And that is why it is important for us to have a basket where women can choose. At this particular time, this works for me. Now it doesn't work anymore, and this is what I need. And research has shown us that once women are given tools that they want, they prefer, they adhere to those tools much more often, and also their protection levels go up. And this is something that we should really, really pay attention to, and give women the tools and the information to have them be in control of their own lives, of their own protection. Oftentimes, women are basing on the fact that, is my partner being faithful? Is my partner willing to wear a condom? Is my partner doing ABCD? So we need to give them tools that they are in control of like, I'm safe, regardless of what he's doing or what they are up to or what they are doing. I am protecting myself, and that is what we should focus on. Yes.
Thank you so much. Thank you so much, Shakira. Shakira is a young woman. I'm a young woman, and we are asking and demanding for choice. We want to be able to have an opinion, to make our own decisions on accessing prevention methods of HIV. So, women in sub-Saharan Africa are saying we are demanding choice.
Yes.
So I am calling upon funders, policymakers to give us the choice that we are asking for, help us in implementing these preventative methods, fund the ring, facilitate choice. Thank you so much, Shakira, for joining in. Women are ready for the ring. We want the ring, and we need the stakeholders to come together and give us the ring. Thank you so much for joining us. We have these conversations every Thursdays at this time. So see you next time, next week, Thursday. Bye.
Bye, guys. Thank you for having me. Mwah.